This is deep transverse friction to a hamstring tendon. So this would be where somebody was having chronic pain in their hamstring tendon, possibly after a tear or after a chronic overuse injury. We would locate the pain and the scar tissue on the correct tendon just above the back of the knee. You could check that you are on the hamstring tendon by just resisting its action, so asking your patient to pull their heel upwards and flexing their knee. And then you would identify the thickened scarring and the patient's pain location as well. Do you feel that?
Yeah.
Okay. Once you've found that, you get the muscle into relaxed position, so ask the patient to just relax. And then you want to take up a depth onto the tissue using either reinforced fingers or reinforced thumbs. So if we were using reinforced fingers, we want to make sure that we keep the joints in our fingers nice and relaxed and in a flexed position and not allowing them to come into extension. So we sink down onto the scarred tissue. And then at that depth, we make sure that we maintain that and friction across the tendon in a transverse direction. We would continue that frictioning for 60 seconds, making sure that it had numbed off at that point. After 60 seconds, we would come off and allow that area to actually recover for about 30 seconds, at which point we would go back in, sink back onto that tissue at depth, and then transversely friction back over that tendon. And we would continue that pattern for 10 minutes in total.